The Secure Health Program is a very innovative program that is focusing on strengthening leadership and capacity of policymakers, that is the high-level policymakers and the mid-level policymakers, to really demand and use research evidence in their daily work. Decision making is a process that is influenced by so many factors, and research is just one of them. And one of the things we are doing really is to frame this program in a way that it is addressing issues that the policymakers are concerned about. So, for instance, the ministry has all these strategies and goals that they have put in place. Now, we are framing this program in a way that we are presenting it as supporting the ministry to realize their goals. Because we want ministry officials, the PS, we want the parliamentarian to see this program as what is in it for me. This program is helping me achieve A, B, C, D. And that's not an easy thing, actually, to do. Because we have, first of all, to understand what is the ministry doing, what are their priorities for this year, and how does this program support that. Kenya and Malawi are fairly different. They have some similarities in the sense that both governments are really prioritizing research, because they both have divisions of research within the Ministry of Health, which is a good thing. Not many governments have such divisions. Often they have the division of planning, and that is it. Running this program in Kenya and Malawi will help us do some comparisons, particularly on what really influences research use in two different contexts with different issues or different skills. Initially, Secure Health Program from the very beginning has been a consortium of 5 institutions. That is AFIDEP, EXA, EXA-HC, that's EXA Health Community, there's FHI 360, the US office, but also the country offices in Kenya and Malawi. There is CNHR, which is the Consortium for Health Research in Kenya, and there is College of Medicine in Malawi. So those are the 5 key partners for the program, implementing both in Kenya and Malawi. But then for Secure Health Program to succeed, we realized that we need to actually partner with the Ministry of Health and with Parliament. And so part of the inception phase has been, can we establish that partnership and bring in the ministry as a partner, and bring in Parliament as a partner. And we have really done very well, because we've held all these high-level consultations with the PS, with the clerk of the National Assembly in Kenya and Malawi, and they have been receptive. They've both told us, can we prepare MOUs to formalize our partnerships, because they really want to be part of the Secure Health Program. Rather than Secure Health Program being delivered to them, they want to be within it to influence and inform the design of the interventions and how they're implemented. So I think the partnerships have expanded quite well, bringing in key people, the ministry and Parliament. I think that's moving quite well. UK Post stands for UK Parliamentary Office for Science and Technology. And basically what that organization does is to work with UK MPs to provide them with evidence or do analysis for them and provide them with all the information they need to debate policies or legislations within the UK Parliament. And so UK Post comes in because we really want to connect them with the parliamentary staff in Kenya and Malawi, because they have in the past run programs with parliamentary staff and MPs in Uganda. And that happened about 4 years ago. It went quite well, I think. But we want to draw lessons from their work in Uganda to use that program to now adapt it to Kenya and Malawi. And basically we'll have parliamentary staff, basically clerks and research staff, having internships in the UK Parliament for 1 month. I mean, obviously in collaboration with the UK Post. And then after that 1 month, they will work with they will have mentors from UK Post who will work with them over the 3 years of the program or 2 years of the program, just to mentor them, build that capacity, and also support them in where do you get evidence, how do you link with researchers, how do you analyze it, how do you present it to members of Parliament who, as you know, they have obviously very many other interests, and research is just like a small bit of it. 3 things. Secure Health is setting up right now to strengthen high-level capacity, one thing. To build capacity of mid-level policymakers to be to have the skills to generate and synthesize evidence for policymakers, and then institutional strengthening. So 3 years later, I would be very happy if we have champions within the ministry, you know, like, and champions in the sense that the people who are sitting in this meeting, for instance, the directors of different departments in the ministry, are talking evidence. They are demanding for it. They are requiring their staff to put the evidence on the table, other than just, you know, not bothering with it at all. Because as status quo right now, some of the interviews we did, our staff have indicated that nobody's interested in them, whether they use the research or not, no one bothers. So 3 years later, I'm thinking we want to have directors of different departments who actually require evidence. You know, if they ask somebody to do something and their staff, they're like, which papers did you look at? How do they inform this decision? That is individual level. Institutional level, I'm hoping that 3 years later, for instance, the Ministry of Health in Kenya will have a good library, will have good databases, will have a good institutional frameworks or support guidelines that really promote data and evidence use. Because right now, those are not there. Even a library, I think, is not there. At the mid-level, where we're training policymakers to giving them actual skills in analysis, in presentation, in networking, we hope that at the end of the 3 years, we'll have a pool of policymakers at the mid-level who are able to, to analyze critically, you know, like if there is an issue like the issue of Mira, they're able to have very clear policy questions. They're able to know who they can reach out to. But even beyond reaching out to, they're able to get the data from different sources, be they journals, be they databases, and synthesize it in a one-pager, you know, for the PS or for the, because those are the kind of skills we're being told are not there. So if they're able to do that 3 years later from now, I'll be very happy. I think secure health is innovative because it's focusing on something that we haven't really focused on. And even in the literature, we don't know what you can do with policymakers for them to use evidence. We know what you can do with researchers. You know, you can train them to do policy briefs, you can train them to do very good PowerPoints, you can train them to simplify their very complex research, but what do you do with policymakers? That we really don't know. Even there isn't evidence or research that tells you what to do. So the part into that we want to experiment and see what works and what doesn't work, with strengthening policymakers' capacity and leadership to use evidence.